Recovered from COVID-19, your plasma could be valuable to other patients suffering from the virus. We've talked about that here because it contains, they believe, antibodies that might be fighting and controlling the virus. IU Health started asking survivors to donate plasma several weeks ago for potential treatment back in April. And joining me now live with an update is Dr. Nicholas Barros, a transplant infectious disease specialist at IU Health. And doctor, first of all, good morning and thank you for all of your work during the middle of this pandemic and helping to save lives.
Well, thank you for the invitation. I'm glad to be here with you guys.
Yeah, let's talk about this first of all. Convalescent plasma, for people who might not really understand how this works and how you all are using it, what do you tell people?
So the plasma is the liquid part of the blood, and in that liquid part, you have all the antibodies that your body has created to fight multiple infections. Among them, the patients that have recovered from COVID-19 may have neutralizing antibodies that may render the virus innocuous to the other person. Mm-hmm. So you can help fight the disease with this neutralizing antibody. So the idea is taking the plasma from patients that have recovered from COVID-19 and transfused it into patients that are currently struggling with COVID-19 and using these neutralizing antibodies to neutralize the virus in the person that's struggling.
I know that there are so many people that have overcome coronavirus in Indiana. So many people want to give back. Have you been able to get the word out in a nice way where you've had a lot of donations? Where do the numbers stand?
Yes. So I've been extremely happy to see how many Hoosiers have been standing up to help others, other Hoosiers in this problem during this pandemic. We have 800 people that log into our webpage through IU Health to register and be donors. Of them, 341 were able to go through all the appropriate screening, and they were referred to the blood centers for appropriate donation. And of them, 63 have already donated, and that's about almost 50% of the entire donation that has occurred through our local blood centers.
That's awesome.
While it's only 63 patients, these patients have donated on multiple occasions, and they have provided almost 600 units of plasma that can be used to help other Hoosiers in the community.
Let's talk about the second wave that we're hearing about that might happen. Not for sure, but that if it does, I know that you talked about the shelf life being a year of plasma. Are you guys trying to maybe stock up a certain amount, or do you have a number that you want to hit of people that might be able to actually donate?
So it's difficult to know exactly how many people that would like to donate, because that is really depending on how big the second wave could potentially be. And it's currently very difficult to determine that type of problems. Now, we do have the potential capability of storing plasma units both at the local centers and also in the blood banks at the different institutions. So the hope is that if the second pandemic comes, we're already prepared with abundant amount of units of COVID-19 convalescent plasma.
Well, Dr. Barros, we're out of time, but we're going to have a link and a spot for people to be able to donate on our website, okay?
Thank you very much.
Thank you for joining us. What a pleasure. If you would like to donate, yes, your plasma, go to fox59.com/links.
Interesting.
And